Maisuka Health Center is located in Uganda, Chakazile Village, Chibale District. This is one of the hardest to reach areas in the country. Lying off the main national grid, the health center does its best to serve a community of about 20,000 people. Without electricity to power the day-to-day community needs, key services to support the everyday life do not come easy. It is on the basis of this and more that Environmental Alert teamed up with Südwind and with support from the Federal Ministry of Health and Social Protection in Austria, they embarked on ensuring that the Community Health Center in Maisuka gets the power it needs for its basic health services.
So with this project, we're helping out with the four health centers. First of all, in the hard-to-reach areas of this in this Albertine region, and the areas that are being served by refugees. So in this particular case, the one in Maisuka is basically served with by the locals in the area, and it's one of those areas that are off-grid. And by the time we sit down to see that this project is enrolled to this region, we wanted to help out with the general welfare of the health center, which is an health center 3, and help them with first of all the installation of the solar, and then also to help out with the areas to do with immunization, because initially they could not handle the vaccines because they didn't have the electricity. So with the installation of the solar, we thought that this can help them also boost their immunization rates. And also, there are situations whereby initially the major problem that we had envisaged was the mothers, especially the expectant mothers, could not give birth during the night. We realized by the time we went there, the health workers were actually using torches to deliver these mothers. So with the installations of the systems, we anticipated that these services would improve. And also trying to help out with the general reproductive health education of the locals around, and also increase the rate of patients coming into the health center.
Environmental Alert and Südwind are implementing a joint project called Empower Healthcare in Uganda project. The project aims at supporting health centers in hard-to-reach areas and refugee settlements in Uganda that are faced with energy access limitation. For Maisuka in Chibale district, the installation of power is a sign of the good times ahead. The community took off time to tell us about the difficult past they endured before the solar power came.
Choko mukugenda twarabaga nsintuwe kuranka enjoka hatari muhanda nekiro neki no sange mbogo zahingura entale zahingura enjojo zahingura empisi buri kisoro kiona kiri mukisaka muno choka mzeye gobo yayizireyo yaguma yamara yo bwire ekiye kusimira ruhanga mzeye yo gwakayijali ali na family yaye yonka choka ruhanga yamukingurura aho yafunaki ezali inkerebe bafoka abantu ekyo cyo kusimira ruhanga bayisemo hakwa twatwinde bisoro biri bingi omucyaro muno nabiyetoroyire otakusaka kubyara muhogo cyoka twagamba ruhanga bwana orora ngo hinduremu otuyambe.
The song that we have been singing is a Nyankero Chiga song, and we're demonstrating that this is what we have been waiting for. The word goes Nichoto Abenitwenda. The word Nichoto Abenitwenda means this is what we wanted. So people have been very happy, and we're still happy for this wonderful installation of solar power on our health center 3, because we see very many things are going to improve in as far as health services is concerned.
Apart from supporting expectant mothers during delivery, the presence of power has also made it possible for the health center to work more efficiently in addressing other problematic diseases like malaria, as well as the immunization needs. This is something that was not possible before.
There's also immunization. It has been reported that now the immunization rate is increasing. Now the fact that vaccines are being kept at the health center, I think that is also exciting. We expect that the numbers of babies being immunized, I think, will also increase. This is basically due to the fact that now the health center has refrigeration facilities. And I think as well, we're yet to get confirmation from the health center, but I think they should be able to utilize the microscopes and also take some samples, blood samples, and be able to also check, which at the end of the day will also help the patients out there, instead of walking distances to maybe another 50 kilometers to seeking better services. So with the Maisuka getting the solar equipment, the lighting system, the refrigeration services, we hope that everything can be undertaken in one roof.
We came with the 17 solar panels on this health center in Maisuka, and we have installed them on all the different departments of the health center. Right now I am working on the maternity department, and this is the system that we have installed here. It is a 5 kVA power system, and this is it as you see it here. This is the combinable boxes where the power from the solar panels reach, and they are controlled from here. And also this is our inverter, the 5 kVA inverter. It will be able to give enough power for this maternity department because it's powerful enough to give all the lights that are on it, and also the surgery department, the theater. It will be able to supply it because it's 5 kVA according to the power we saw and we estimated here. It will be in a position to supply it and to meet the need of the doctors and of the patients that come around here.
With the solar power available now, there are other essential enablers of life that have now been made possible. This solar power project was not just about giving the health center the light they needed for their operations. The project has also been working on a holistic approach to community development, giving the members the skills they need to lead more productive lives in different aspects.
We have got to improve our security because in the past it has been darkness all over during the night hours, but now at least it is a city in the village when you see our facility. It has increased the turn up of patients because when there is night, right at night, patients get to know that health workers are there waiting for them and they can get access. Then the other third thing is yesterday I was in the planning meeting at the district, and they promised to give us the computer gadgets which will help us to report our weekly data, our daily data, our monthly data, our quarterly data at a level of health center, plus getting the stationary services like photocopying, printing, because those small things have been taking a lot of budget, because you have to travel from here to Karuguza to print out a duty roster. And now we hope those services are going to be nearer in the in-charge's office.
Environmental Alert has been carrying out training of community leaders, village health teams about basic primary health care standards. Some of this training involves basic governance issues as well as self-help initiatives that are crucial to sustaining the solar power project and other skills as well. Given the presence of solar power now, the community still faces a number of challenges as well. Some of these challenges include access to regular and clean water, because it suffers from a long dry spell. Some of the community members we interfaced with also registered the need of a comfortable and well-motorized community ambulance that can help them in navigating the hard roads. Despite all this, Environmental Alert is optimistic that with more commitments, they will be able to address more of the community needs and also be able to extend their services to other areas as well.
We would like, of course, to continue with this exercise and also going beyond the 4 districts that we're operating in. What is straining us now are the funds. So we call upon the different stakeholders out there, the different donors out there, the Ministry of Health, the Ministry of Energy, to come in, the different donors out there in the world to come in and try to see that they had to reach and the off-grid and the areas that are serving the refugees, we can provide better services to them. I would be happy if probably we can get another phase of funding so that at least we expand this project beyond the 4 districts that were initially targeted.